Good morning, everyone. I'm Micah Aberson. I'm the Executive Vice President for Sanford Health. We're excited to have you here today. We're excited to have the Governor and Secretary Kim Malzahn-Risden to make a very exciting announcement about some clinical trials that we are eager to partner with the state on to get up and running effective today to help with the COVID-19 spread. I think that what you're going to hear and see today is a great demonstration that the entrepreneurial and pioneering spirit is alive and well within healthcare in the Dakotas. Said another way, we're going on offense against this virus. I want to thank the Governor, her support, Secretary Malzahn-Risden for everything that she's done for their assistance in getting us some of the drug that's necessary to pursue the trials that you're going to hear about today. And from there, I'll introduce Governor Noem to make a couple of comments, and then our physicians, Dr. Allison Suttle, to talk about the trial specifics. Thank you.
Well, good morning, everyone. We're continuing to every single day across the state of South Dakota, allowing science and facts to drive our decision-making to fight COVID-19 throughout the state. Fortunately, thanks to all of the people that live in this state, we're doing well. We've got, the spread has been slowed down. If we had taken no actions whatsoever, the original modeling and projections had us peaking in the middle of April. So what we've been able to do by putting in mitigation efforts, limiting group sizes, telling people to stay home, focusing on hygiene and washing of hands, we've been able to push that peak off and get it into a situation to where our healthcare systems can deal with this virus and take care of people. Today, we're very excited to have an announcement that talks about us going on offense against COVID-19 in our state. We are going to be the first state in the nation to run a statewide clinical trial on hydroxychloroquine. It will be used to fight COVID-19, and the team behind me, Sanford Health, has helped lead this effort. Throughout the last week, I've been in direct communication with the White House, with President Trump's team, spoken with Vice President Pence, Jared Kushner, the Chief of Staff, many within the task force on making sure that they knew what we wanted to do here in South Dakota, that we had all of our health systems on board in partnering with us, that not only will Sanford be leading the effort, but that Avera and Monument will be participating as well, and that this would be the first ever state-endorsed, state-backed, statewide clinical trial available in the United States to help take care of our people here that would not only treat patients, but it would also give us the data we need to be prepared to fight this virus long into the future. Over the weekend, we received the initial first doses of the drug. And we will get this trial up and running, and my understanding is that there may be some patients already receiving this today. Thanks to the leadership of Sanford Health and the assistance of their medical teams, and for Avera and Monument being willing to partner with us, I'm excited about what's ahead. There's so many things today that can get discouraging. We see increasing positive cases in the state of South Dakota. We see new people and families being impacted, yet we know that all of this has been expected. For weeks, we've been talking about the fact that we would see this virus come. The science of the virus tells us we can't stop it, but that we can slow it down and that we can take care of people while we're dealing with it. And this today, this announcement will make sure that we do that in the best way possible, and we're going on offense to help every single person deal with this virus and be willing to fight it and get better and go home to their families. Our leaders here have collaborated with my administration throughout the fight, and I'm just so proud that they're willing to respond in this unprecedented manner, leading national research efforts as well. So I'm going to let Dr. Suttle go into the details of the trial and how many people will be impacted and what this will benefit, not just for our state, but for the country. Dr. Suttle.
Thanks, Governor. So I'd like to thank the Governor and Secretary Malzahn-Risden. This is an excellent opportunity and just a fabulous day. It's unprecedented times that we face, and it calls for unprecedented measures. And getting all the health systems in one state together to come together with the support of the health department and the state, we really have an option and we have hope for South Dakotans. It shows how public health and the state and community health systems can really come together, that when there is truly a pandemic, or when there is an urgency, we put aside our differences and really come together to help the communities that we serve. It's not often that a physician faces an unknown illness. It doesn't come around very much. We know how to treat pneumonia. We know how to treat sepsis. We know how to treat influenza. This is a new disease that our physicians have no treatment options for. So it takes research, and it takes a lot of information and data to determine what is a successful treatment, what is a therapy that we can use for a patient with COVID-19. And by using research and by doing clinical trials, we can determine if medications like hydroxychloroquine can have an impact on the disease progression, and it brings hope. As a physician, I want to know that what I'm prescribing is going to make a difference for that patient. It's not going to do harm, it's actually going to help that patient. There's going to be two different components to the clinical trials. The first component is a registry trial, and that's for patients who have COVID-19 disease. They're positive for COVID-19. Those patients will be inpatient or outpatient, and they will have the option to receive hydroxychloroquine. In the inpatient setting, they can receive hydroxychloroquine with the azithromycin, and on the outpatient setting, they can receive the hydroxychloroquine. So now that the state has been able to get enough samples and enough of the medication, every South Dakotan who has COVID-19 can have that discussion with their physician. Am I a candidate? Am I a good option to receive hydroxychloroquine to help fight this disease? The second side of the clinical trial is an actual clinical trial that is randomized. And that's for patients that have been exposed to COVID-19. That's healthcare workers that have been exposed that could either receive the placebo or receive hydroxychloroquine. The second part of that is those high-risk individuals that we've all been talking about. Those with age greater than 60, those that have chronic medical conditions. If those individuals have been exposed, let's say they live in a household of someone with COVID-19, they could receive the hydroxychloroquine or the placebo. The way the hydroxychloroquine works is that you take it similar to a Z-Pak. You take a loading dose and then you take it for about 4 or 5 days, but it stays in your body for up to 50 days, for anywhere from 30 to 50 days. So it will help those individuals that might be exposed to potentially fight the illness. We know that hydroxychloroquine has the potential to work, or we are learning that it has the potential to work by preventing the virus from entering a cell. That prevents the virus from then spreading. The only way a virus works is if it can infect another person and another person and another person. So if we prevent the virus from entering the human cell, we can stop the virus from spreading. We also think the hydroxychloroquine might work by preventing the inflammatory response. So what we hope to do today, by having these clinical trials, by offering this medication to all of those that might be impacted by COVID, is to really provide a treatment, to provide hope, to increase the information that we know about medications, and to learn what works. This virus will be with us for a while. And if we can learn today what works and what doesn't, then we will have a treatment in the future. Thank you.
Let's open it up for questions. Oh, yes, Dr. Archer. Sorry about that. Dr. Archer, would you like to make a few comments? That'd be great.
Thank you. We're very appreciative to the governor and the State Department of Health for this opportunity. We're hopeful, and like Allison, I share the hope. Option demonstrates an impact on this. There's only a couple trials currently running in the U.S., so this chance to participate really is potentially groundbreaking for us. Our clinical research department at Monument Health will lead our collaboration with the state, Stanford and Avera, and we look forward to this opportunity.
Yes, and Dr. Erickson, would you like to share as well?
Thank you, Governor. Yes, and I'd like to share my thanks to the Governor and Secretary for the work they've done, and I appreciate the opportunity to join virtually as Dr. Archer and I are attending virtually today. I also want to thank my colleagues, Dr. Archer, and Dr. Suttle for the work and things they've done on this. We're very supportive of this clinical trial, and I think it's a great opportunity to do statewide research. I think we have much to learn about the virus and the disease and the various treatment opportunities. So the fact that we can put this in a clinical trial and do research really will help move some of this forward. I think we still need to practice all the things the governor, you share every day. It's social distancing, physical distancing, stay home, hand hygiene, and certainly clean surfaces and devices, because we don't have a vaccine or a clear treatment at this time. I receive a number of questions asking about zinc and vitamin C and antivirals, convalescent plasma, and ventilator therapy even. And so I think the opportunity to continue with research, clinical trials to help move the science and the data forward is a huge win for us. So my thanks to you, Governor, and the Secretary, and to my colleagues. Thank you.
No, thank you very much to Dr. Erickson, Dr. Archer, so much for your partnership in this. I know your systems have been partners with us since we started talking about this virus, even several months ago now, and just want to thank you for taking care of the people of South Dakota along with Sanford Health going forward. So this is, again, an exciting day because it is unprecedented in the fact that it will be the first ever statewide clinical trial happening in the United States to deal with COVID-19 in the future. We are months, if not over a year away from a vaccine coming to fruition. We are using every tool we have available to us. The people of South Dakota are looking for answers, and our mitigation efforts, along with developments in technology and using the CARE-19 app to help with contact tracing, and now this clinical trial and treatment for patients in the state is going to help us get through this together, and we'll come out the other side strong. So with that, let's open it up to any questions that you may have. Don?
How do patients become part of the clinical trial?
How do they? I'll let Dr. Suttle talk to that.
So if a patient is admitted to the hospital and tested and has COVID-19, there's really a conversation between that physician and that patient to determine. And patients can bring it up. If they want to be a part of the clinical trial, they can ask their care provider. But it really is that conversation between the physician. And if it's an outpatient and they're positive for COVID, same thing. They would just talk to their physician when they get their test results. Can I be a part of that clinical trial and get the hydroxychloroquine?
I think the important thing to note is that Dr. Suttle can give more details to it, is that a clinical trial starts with about 2,000 people. We can treat up to 100,000 people with the amount of doses that we have in the state of South Dakota. So that number is very significant for the amount of drugs that we've been able to secure with partnership from the health systems, but also the federal government stepped up in a huge way to give us the doses that we need. My initial request to them was $1.2 million, and they will be supplying that for us. So that 100,000 patients that can be treated is something that should let South Dakotans know that those who have high-risk situations, our healthcare providers could participate to protect them, because they're obviously exposed to individuals that are out there dealing with the virus, and also have a balance of individuals that will receive it that are struggling to get better.
And I'm not sure how clinical trials work, but does your health insurance cover it, or is it free?
Clinical trials are funded by the organizations, so it's not a cost to the patient to be enrolled in the clinical trial. The outpatient clinical trial with the placebo and those that are the prophylaxis or those exposed, that's really those 2,000 that we want to treat. The inpatients and the outpatients that have COVID, we can treat as many patients as needed in that registry trial. So there's not a limitation to how many of those that are positive with the disease that we could treat. And again, what we really want to find out is, does this medication work? And we're contributing to the science to know long-term if it works. But I will say Sanford isn't stopping there. We have a lot of other clinical trials that we're doing as well, with using a convalescent plasma, other antivirals, things that work with the immune system. So we've got a lot of other clinical trials that we're working on as well.
And the state will be supporting those efforts as well. Yes, question on the phone?
Yes, Governor, this is Kara Hart with the Red River Farm Radio Network. Thank you for taking my question. And this is still COVID related, my question, but more focused on the agriculture side of things. On Saturday, you sent a letter to Smithfield asking them to take care of the coronavirus concerns. And on Sunday, of course, as I know you know, Smithfield decided to close the Sioux Falls plant. Is there anything else you'd like to say about Smithfield's closure on Sunday? Have you talked to them since they've closed?
I did. I talked to Ken Sullivan this morning. We're going to continue to talk later this afternoon or tomorrow morning and discuss the future of when they can get back up and running. I think the letter and the request made to them they're looking at, but also knowing that it gives their employees time to go home, to heal, to visit with their families, and make sure that we're taking good action going forward to protect the community as well. I know that Smithfield has done incredible work inside the facility for mitigation efforts, putting in infrastructure to protect their employees, and also what they did to make sure that they identified those who may be struggling with the virus or exposed to it. So we'll continue to work with them and get them up online as soon as it's appropriate for public health reasons.
Governor had a chance to talk to the mayor about his request of shelter in place, and how do you feel about that?
I spoke to the mayor on Saturday afternoon that he would be requesting that. He did, I understand earlier this morning, say that he was still considering that. My team's evaluating it, and I'll go back to what I've been saying for weeks, is this is something to look at, but you need to consider that at the appropriate time to make the biggest difference on when you could see people surge into our hospital systems. Remember that the model we all agreed to in the state of South Dakota was a model of planning and preparation for how many people we could handle in hospital beds, in ICU beds, and with ventilators at our peak time. That's 5,000 hospital beds we'll need to add, ICU beds, we needed 1,300 vents. That's the plan that Sanford, Avera, Monument all agreed to with us. And then whatever mitigation plans we put in place, we need to be able to sustain them. And so we're looking at that and evaluating all that. We're still within our model with the infection or the positive rates we're seeing in Sioux Falls. So as far as the statewide model, that hasn't changed, but we're looking at what specifically is going on here in Sioux Falls to see what the appropriate action might be.
Governor Noem, City Journal. Do doctors need patient and family consent for this treatment? What side effects should people know about? And for any patients needing it for proven treatments in the state like lupus, will we still have enough of the treatment for those patients?
So the first question, I think, was informed consent. And yes, we do inform consent for the clinical trial with the randomized controlled trial as well as the registry trial. So there will be informed consent. With regards to side effects, many of the common side effects that you can find with a lot of medications, some nausea, fatigue, those sorts of things. There are some contraindications. So there are some individuals that are not candidates for the medication. And this ensures that we have adequate medication for those with rheumatoid arthritis and the other illnesses that actually use the medication as well. So we will not be needing to dip into their supply.
Further
Governor,
questions on the phone?
From IP.
Yes, Stephen.
Governor, this is Stephen. So it seems like you are being aggressive on the treatment and the medication side. You know, the first state to have a statewide clinical trial of this, but less aggressive on the stay-at-home orders. Can you speak to that? Is that your strategy going forward? And, you know, how do you see your strategy differing from efforts in other states?
Well, I would disagree with that, Stephen. I would say that the response we've gotten out of the people of South Dakota into my calling for them to stay at home for weeks has been much greater than some of those states that issued shelter-in-place orders. The people of South Dakota have been phenomenal. They have stepped up. They've dramatically decreased leaving their homes. I understand it's taking days to get their online orders of groceries picked up and on time because so many people are doing that. Our traffic counts have been down across the state overwhelmingly, the people have responded. I've been proud of their recognition of personal responsibility in this situation. And when I look at many other states that do have shelter-in-place orders and the fact that people aren't complying and we're getting better results, I would say that South Dakota, once again, has proven me right, that we are a fantastic state with people that understand their role in making sure that we're protecting our communities.
Good morning. This is Ariel with the Rapid City Journal. Can you hear me?
Yes, I can.
Okay, and this is for you or the health secretary. My question is about, are we able to get some data that other states have been sharing? Other states are sharing racial data. Arizona just released some and it shows Native Americans are being more impacted, whereas in other states it's African Americans. They're breaking it down by zip code. And then also their State Department of Corrections are breaking it down by not just positive tests, but in each prison, how many people have been tested and pending. I can tell you there's a lot of concern and rumors going around for loved ones of people in prison, and they want to know what's going on. So it's a question about—
Ariel, this is Kim Malson-Risden.
Thanks.
Thank you for those questions. And so I think if you look at how we've been able to provide data around positive and negative COVID cases, that has continued to evolve as we have more data. And I think that will continue to evolve and we'll be able to provide more. Part of our issue is that we need to ensure that any data that we release can't lead to the identification of specific individuals. That's a core function in public health reporting. And so that's, part of what we have to deal with as we're releasing that data. Speaking to the racial, disparity, we do not have that data available. We are not seeing large racial disparity, though, I can tell you that. But as we get more cases and we're able to break out data at a finer detail, we will do that. Regarding your question around cases in the correctional system, we've been very open with the status of that. We've had one total positive case of anybody in our state correctional institutions, and that remains the same today. That person has recovered, and we do not have any other positive cases, and we'll continue to update folks as any of those situations change.
Okay, but no plans to share how many people are being tested in the prisons as other states are? Just like we have pending cases in each county.
Right. So some of the challenges with reporting testing, as you know, our ability to test people has greatly increased in the state. Just not that long ago, the only option was the state public health lab. That has quadrupled with the advent of commercial lab capacity, with folks like Sanford being able to test, and Avera and Monument, and machines being deployed to IHS facilities across the state. So our ability to track what's going on with all of that different testing happening is not going to let us, report out all the details about who is being tested. But you can be sure that we will report out aggregate numbers when we have them, and certainly details around positive cases.
Thank you.
And then regarding the trial test, how soon do you believe we can start seeing results on whether this drug is effective against COVID-19?
So the trial can go out up to 5 years, but we will probably start getting results. The more patients that enroll, the more results that we'll get. So I think there's some short-term wins we can get from the results, and then we'll also be evaluating long-term. So I don't know that I can give you a specific month or day, but we'll learn more and we will share as soon as we know more. I think we've already been treating patients in the registry, and I believe we have a paper coming out later this week, if not next week, with regards to that.
We had a viewer just send me a question. Will the VA be a part of the clinical trial as well?
I'm in discussions with the VA to incorporate them into the clinical trial as well. There's obviously working through IRBs and different things there, but we will offer it to the VA if it's possible.
And the IHS?
Yes, and the IHS. Good question. Thank you.
Governor Lee Ross from Fox News, good morning. Over the weekend, you said the virus is going to infect everyone. It's only a matter of when. My question is, at what point does the value in delaying the inevitable, delaying the peak, get outweighed by the economic devastation we're seeing now, especially with hospitals in wide swaths of the country with underutilized, empty beds? Shouldn't you and your fellow governors give direction now to open up, at least for the relatively young and healthy who we've seen are coping very well with the virus?
Well, to clarify, what I have consistently said since back in January and February is that 30 to 70% of the population we could expect would contract the virus at some point in time. South Dakota's peak would be showing still at this point in time to be in mid-June for the peak infection rate. That doesn't mean that different parts of the state won't peak sooner than that. And we're continuing to take a targeted approach in how we look at our state and our populations and what mitigation efforts might need to be put into place. So, as we've talked before, there's a lot of elements to this virus. Public health is extremely important, and we're looking at that as paramount each and every day. We're also looking at the stress this is causing on families, the need to put food on their table, to put a roof over their heads, and to deal with the mental health aspect as well. Those are things that our state government departments and agencies are all dealing with, and making sure that we're preparing people, helping not just families get through this, but keep our small town businesses open, to keep our larger employers in the state doing well. And it's a balance. But our number one goal is to know that and remember and to keep perspective that we can't stop the virus. We know that the science behind it, we can slow it down. And how we do that needs to be very specific and targeted, and make sure we're protecting the most vulnerable, which is why people have seen me take the efforts in different areas of the state that I have, and then make sure we're dealing with this and we're able to get back to what we love, and that's our South Dakota way of life.
Governor JP from KORN News Radio in Mitchell.
Yep, go ahead, JP.
Thank you. The latest COVID-19 numbers have just been released by the state health department. And I was wondering, have we got any more numbers as to the numbers of people who work at Smithfield who are infected?
Sure, I'll let the Secretary of Health talk specifically about those numbers.
So with the numbers that we released today, we have a total of, excuse me, I'm checking my notes here. We have a total of 138 new cases today. 57 of those cases are with Smithfield employees. So far, we've had 10 individuals from Smithfield hospitalized. That's out of a total of 44 people in the state hospitalized. Are there other questions I can answer about the numbers today?
This is Seth Tupper at South Dakota Public Broadcasting. Just wondering if you can tell us anything about what contact tracing has shown about how the virus got into the Smithfield population in the first place, if you know anything about that yet.
Well, since we investigate every single positive case that we see in the state, and when we started seeing cases of different employees at the Smithfield location, we did specific contact tracing there to better understand, were these people that work together? Did they work the same shift? Do they work in the same environment? And so that's definitely a part of the investigation that we've been working on. This is a disease that spreads through personal contact. And I think anytime you have a place, whether that's an employer or any other place where there's just a large number of people coming into contact with each other, that's how we know the virus spreads. So each individual investigation, it does include where they work. It also includes who else they've come into contact with. Those are close contacts that are defined as being within 6 feet of another person for some period of time. They're not casual contacts. And so those are all part of the contact tracing that we do. When we identify those close contacts, we do let those individuals know that they have been identified and that they should take precautions. They should take precautions in their symptoms. They should be monitoring themselves. They should be doing good social distancing, which we encourage of everybody. But in the event that they, in fact, are infected, we want to make sure that they're not spreading it to other people if we can avoid that. Does that answer the question there?
Well, I guess specifically, I was curious, do you have any information on, was there some kind of travel that brought this into the population of Smithfield workers? Was it community spread? What started this outbreak? Do you have any information on that specifically?
Yeah, I'm not sure that we can definitively pinpoint, the exact cause of the cases at Smithfield. I can tell you that Minnehaha County did already have substantial community spread at the time that we saw the first case among a Smithfield employee.
Along with the data you just updated us, do you have the recoveries? How many recoveries?
Absolutely. Thank you for that question. We have 10 new individuals who have recovered, and that is part of our 207 people statewide who have recovered. I do think it's important, certainly not to minimize the gravity of this situation, but most people recover. 80% of people are going to have very mild symptoms. And so again, as the governor said, we've got to keep this and these numbers into perspective. We expect thousands of cases of COVID before we're done with this in South Dakota. And we're going to see a lot more people hospitalized. That's just the fact of this matter. But the things that we're announcing today with clinical trials happening, with better access to drugs for possible treatment, those are encouraging as we fight this ahead.
Governor, this is Mark with the Black Hills Pioneer.
Yes, go ahead, Mark.
With this weekend's announcement of enhanced testing, I believe is the word that was used for Sioux Falls and specifically those around the Smithfield food plant. Can you speak to the strategy of a more aggressive testing in that area?
Well, what we're announcing today is a clinical trial for a therapeutic, which would be a treatment for those who are COVID positive and that would need some assistance to help recover and do that quicker. But your question in regards to testing is one that, yes, we are testing more aggressively. We've gotten more labs up and running in the state, which allows us to do that, and more supplies. I was on the phone last night with Jared Kushner talking about our need for much more testing supplies, especially as it relates to our Abbott ID machines that we did get from the federal government. We need the supplies to run those, and we can use those in hot spots, much like we're seeing here in Sioux Falls today. That'll be incredibly helpful for us to get aggressive in slowing down the spread and identifying people and getting them isolated from other vulnerable populations sooner. So those kinds of supplies, the more we get and comes online from private suppliers or through the federal government or any other mechanisms that we're going after, will help us be much more aggressive. And one of the models that I think worked pretty well, we saw earlier already in South Dakota, was what happened in Huron. When Beetle had, it was a county that flared up, and they immediately had some positive cases. Then we had some exposure to other folks. We talked to the mayor. I spoke specifically to the mayor there, gave him direction on what he can do in his community. He pulled his city council, his emergency management director, his county commissioners together. They formed a task force, and they implemented exactly the guidance that we gave them. And now if you look at Beetle County, they're doing much better. They were able to slow down and stop the spread. I think they have 2 or 3 positive cases today, which is wonderful. So if with that kind of partnership around community leaders putting into action the guidance that the state will give them, you can make a big difference in what's happening here in Sioux Falls too. So that's the kind of guidance that we're giving to your mayor, to your health department and your city council and county commissioners, that this is the guidance we'll give you, form a group, get to work, and we'll be good partners in that. But that really was effective in Beetle County, and that's what can happen right here in Minnehaha and Lincoln counties as well.
Governor, you had said that you expect some parts of the state to see a peak earlier than the mid-June projection. Do you expect that Sioux Falls could see a peak earlier than that mid-June projection?
Right now, it looks like Sioux Falls could peak a little earlier than the rest of the state. And so we're continuing to monitor that. And as I have said many times before, remember that these models are projections and that we are reevaluating them daily, if not hourly, on what we're seeing for where we get hot spots, where we get different infection spread, and how that is handled at the local level. Local actions make a big difference too. So it looks like Sioux Falls could peak a couple weeks earlier potentially, and we'll be prepared for that.
And I was wondering, Could you tell me what went into your decision to ask Smithfield to close for 14 days on Saturday?
Well, we're looking at our case rates that were coming back. We were doing our contact tracing. The Department of Health has tripled our amount of staff that are doing contact tracing. This week, we will triple that staff again. Because of when you see positive cases come forward, it takes much more staff to follow up with each of those individuals that are positive, find out who they were with, what locations they were at, and who could potentially have been exposed, and then follow up with those individuals. So we're continuously doing that and making sure that we have the capacity to do a good job of that. One of the technologies we rolled out last week that I want to continue to encourage South Dakotans to do is to go download that Care 19 app on your phone. Please do that. I think we have about 8,000 people that have done it in the state. I need many, many more, because when you do that, it will voluntarily, you opt in to have it use your location services to track where you have gone. If you do test positive in the future, all you have to do is refer back to that app. We immediately have all that information of who could have been exposed to the virus, and it saves us dozens and dozens and dozens of hours. That means our staff can be doing other things to take care of people rather than having to do investigative work when people can't remember where they've been. So please push out to all your folks across the state how important it is that they download that app. It is voluntary, and all the information is anonymous, and it will be destroyed when this event is over. But we absolutely need you to do that to save our staff some time so that they can focus on taking care of people.
Governor, when will that be available for Android phones?
Yeah, this week. They're going to have it up here by the end of the week, which will be great. It's for Apple phones today, and they're going to continue to build out more features. But some of the features we cannot build into it, such as letting you know if you've been near someone who maybe tested positive, until more people participate. So we can add more features when we get more people that download it and opt in, and that would be incredibly helpful if we could get folks to participate in South Dakota. And again, we're only the second state in the nation to be utilizing this kind of technology as well. North Dakota, Governor Burgum and I talked about it for a couple of weeks, and he used his connections to get it built and installed, and North Dakota went online, and we went online the very next day.
Governor, why specifically is South Dakota the first to take on this clinical trial? Is it something that you took the initiative to do? Did the feds think South Dakota was a good spot for this and ask you to do it? What was the reason that South Dakota is the first to do this?
There were several factors in it. I noticed how people took seriously the virus and what a big difference our mitigation efforts made right away. Just by the direction of my first executive order, we cut our peak infection rate and hospitalization rate in half. Then I looked at our systems that we have, the fact that we have Sanford Health here that has a research component to it already, and their ability to stand it up, and then the outstanding partners of Avera and Monument that could implement this statewide, and then our population being a little bit more of a smaller population compared to other states. It's just a perfect fit, and started talking to the administration about it a couple of weeks ago, and said that I would be a state that'd be willing to partner and financially back a clinical trial like this as well, which other states have not done. I think makes it an incredible partnership that's going to be a model for how things can be done in the future. But this is one of the things I've talked about in South Dakota for years, is that we can do things other states can't do. And it's because of the people that we have here, the people that have made investments here for decades that give us the healthcare institutions that we have, the people that are willing to think out of the box and approach things in a different way. And so this is one of those areas where we're seeing that we truly can fill a role, not just for our people in South Dakota, but for our country. Doing research that our country and the world needs is incredibly special. Further questions?
Governor, can you speak to what this trial would cost the state, if anything?
We're talking about that, but I've agreed to financially help support that. And obviously some of the dollars from COVID response that we're receiving from the federal government could potentially be a part of that funding source as well. So we will stop with questions there. I did want to ask Dr. Erickson if he had any final words that he wanted to share. I know it was tough to go to questions for them because they were remote, but Dr. Erickson, did you have any closing words you'd like to share with us today from Avera?
Thank you, Governor. I certainly want to appreciate your leadership and the secretaries and my colleagues for their hard work on this. And I think it's just a wonderful opportunity for the state of South Dakota and all of us to advance the clinical trials and the research. So thank you for being part of this.
And Dr. Archer from Monument Health, would you like to share a few words?
Yeah, I would echo Dr. Erickson. Thanks and praise for the health system's efforts and health states on this. We're excited to be part of this. And what you'll see from us as we learn more about the statistics of the trial, that our research department will put out a statement here within the next few days about how to participate specifically here in the Monument Health Service area. We look forward to that in the very near future and look forward to working with you all some more.
Great, thank you. I appreciate you all being here today for your questions. If you have any further follow-up questions, just reach out to Maggie in my office. I would like to have Micah close us with a few words from Sanford Health.
Thanks, Governor. I'll wrap up by just once again offering our gratitude to the state, to the governor, and to the secretary for their support and assistance with this. I should also say, and I'd be remiss if I didn't draw attention to the researchers that are in the back of the room. They like to maintain a low profile. Dr. David Pierce and Sharon Hunt, who lead our research enterprise. It's times like these that you sort of validate the investments that have been made over time, and they stand sort of game ready to be able to do what we believe in sort of the integrated health system is truly meaningful, which is to take research from bench to bedside just as quickly as possible. And I think that the investments that have been made over time and the work that David and his team have done uniquely position our organization in partnership with the state and our partners at the other institutions to really make a meaningful impact. It feels great to get on offense against this virus, and we look forward to all the success that's going to come from this. Thank you.